Hey everyone, welcome back. Let's take a look at fish pose. So I have my friend Tracy. She is lying down supine with the knees bent. And you can see that she does have active neck support. And then there's also an additional small blanket underneath her ribs and her back to give her that very subtle thoracic extension. So oftentimes we interpret fish pose as this big thoracic extension with an open throat. But in restorative yoga, we're keeping the chin down, Jalandhara Bandha, cervical spine is neutral, and we're keeping just a very subtle opening of that energy in the belly and the ribs. So thinking about the energies of Samana and Apana Vayu energies here. So I'm going to come on over here and let's look at some propping for her legs as well. So while you're in fish, there's a lot of different things you can do for the legs, and this will be adaptable to a lot of other postures too. We could use a chair. So have you bring your knees to your chest for a second. And if we wanted to, or if it felt right for her, she could have her legs up on top of a chair for fish pose, and this would be similar to fish pose with legs up the wall. So now we're getting more into fusion postures to be able to address specific structural and health concerns in the body. So she does have thoracic extension here, and she has ankles higher than the heart, and the head is lower than the heart. This is considered an inversion of sorts. Other things we could do with the legs, traditional binding with the legs out, or even binding the legs on the chair. If you have a chair and there is this gap here, sometimes it's better to pull the chair away, put a yoga block so that students have something to push their feet into to engage Pada Bandha into Mula Bandha support. Then we could take a blanket, a towel, rolled up yoga mat, bring it over the legs, and again, just a little tuck. Here and then down. There you go. Does it feel okay under the ankles? Okay. And of course, when you ask someone if they feel okay, if they answer in sounds, just that's when you know you're in the right place. That's how you know it's good. Again, for her upper body, you can see that naturally, whatever prop we use under the thoracic spine, for most people's anatomical structure, they will be able to use that propping under their elbow as well. It's common in this pose for people to want to keep their hands on their belly, but they could also keep them out to the side as we looked at before. However, because that propping is under the elbow, we need to address wrist higher than the elbow. So whatever the prop is that's under the elbow, we need to bring something in to get that wrist just a little bit higher if our student is going to take their hands out to the side. So I'm going to come to the side for a second so everyone can see this. You can see the obvious tilt in the pelvis. There is an obvious anterior tilt. You have cervical extension, Jalandhara Bandha engaged, Pada Bandha with the yoga block in the chair, and then binding. So we've actually swaddled her legs to give a passive internal rotation of the inner thigh and in effect to keep Mula Bandha engaged. Thank you.